Your anxiety medication was supposed to be your lifeline, but 6 months later, you're gaining weight, your libido has vanished, and you're feeling emotionally numb. You're wondering, am I broken or is this medication actually making things worse? Here's what your doctor may not have told you about those medications, the shocking truth about why they might be failing you, and the 3 critical factors that determine whether they'll help or harm. Plus, I'll reveal the one question you must ask your doctor before taking another dose. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Last month, Lisa came to my office in tears. She's 48, successful marketing executive, mother of 2. In her words, I started Lexapro 8 months ago for my anxiety. My doctor said it would help, but I feel worse than ever. I've gained 20 pounds, I can't sleep, and I feel like a zombie. Lisa's story isn't unique. It's happening to thousands of perimenopausal women right now. But here's what's really happening and why your anxiety meds might be working against you instead of for you. Right now, millions of women over 40 are struggling with anxiety. You used to handle stress like a champion. Now a simple email from your boss sends your heart racing. Your excessive worrying keeps you awake at night. You're constantly on edge, but exhausted at the same time. Your doctor prescribed an SSRI, maybe Lexapro or Zoloft or Prozac. This will help, she said. Give it 4 to 6 weeks. But what they didn't tell you is this. Your over 40-year-old brain isn't the same as your 25-year-old brain. And the medication that might have worked perfectly in your 20s may not work for you as well right now. Here's the thing. During perimenopause, the brain undergoes significant changes. Estrogen, which acts like fertilizer for your brain cells, starts fluctuating wildly before dropping. This affects how your brain processes serotonin, dopamine, and GABA, the very neurotransmitters your anxiety medication works on. A study found that hormonal fluctuations during perimenopause can actually reduce the effectiveness of SSRIs. Think of it like this. You're trying to fill a bucket with water, but there are holes in the bottom. No matter how much medication you pour in, it's not staying where it needs to be. However, here's where it becomes truly concerning. 3 issues cause anxiety meds like SSRIs to work suboptimally. Number 1, altered metabolism. Your body processes medication differently at 45 than it did at 25. Your liver enzymes slow down, your gut bacteria changes, your hormones are all over the place. This means that Lexapro dose that worked perfectly for your 30-year-old self, it might be too much or too little for your perimenopausal brain. I've seen women on the same dose of medication for years suddenly develop side effects they never had before. Weight gain, brain fog, sexual dysfunction. Here's what's happening. As you get older, your liver enzymes slow down and the liver's ability to metabolize drugs decreases. The liver size and blood flow also decrease with age, which means medications may stay in your body longer and can cause more side effects at the same dose that was safe when you were younger. This is why doctors often recommend lower medication doses for older adults. Number 2, inflammation. Perimenopause triggers inflammation throughout your body, including your brain. When your brain is inflamed, anxiety medications have to work harder. Sometimes they can't work at all. Research shows that women with elevated inflammatory markers are less likely to respond to antidepressants. Think of inflammation like static on a radio. Your medication is trying to send clear signals to your brain receptors, but the inflammation is drowning out the message. This is why some women take higher and higher doses of anxiety medication but still feel terrible. If you're deriving value from this video, subscribe to this channel so you don't miss out on future educative content. But the third way is the most shocking. Number 3, the hormone hijack. Some anxiety medications can actually worsen hormonal imbalances during perimenopause. SSRIs can suppress testosterone production. They can interfere with thyroid function. They can even affect cortisol rhythms. Research shows that SSRIs can lower testosterone by interfering with production in the adrenal gland. Lower testosterone can lead to more fatigue, low mood, and decreased libido, effects that may already be issues in perimenopause. SSRIs can decrease levels of thyroid hormones T3 and T4 in some patients. In rare cases, SSRIs have contributed to hypothyroidism, which can worsen symptoms like weight gain and brain fog. They can also alter cortisol patterns. For example, escitalopram was shown to increase waking cortisol in women and made the daily cortisol curve steeper. This can change your stress response. So overall, some women may find that anti-anxiety or antidepressant medications work differently after age 40, with more side effects related to hormones. Now let's talk about 5 warning signs that indicate your medications are not helping like they should. Number 1, you feel emotionally flat, as if you're watching your life through a mirror. This is called emotional blunting. It affects up to 60% of people on SSRIs. You're not sad, you're not happy either, you're just existing. Number 2, your anxiety improves slightly, but you develop new symptoms, weight gain, insomnia, digestive issues. This is your body telling you something is off. The medication might be masking anxiety, but it's creating other problems. Number 3, you need increasingly higher doses to achieve the same effect. This suggests your body is developing tolerance, or the underlying causes of your anxiety aren't being addressed. This is very common with benzodiazepines like clonopin and Xanax. Number 4, you feel worse during certain times of your cycle, even on medication. This is a huge red flag that hormones are driving your anxiety, not just brain chemical imbalances. Number 5, you've been on the same medication for months, but your anxiety levels remain the same. If any of this sound familiar, it's not your fault and you're not broken. The question becomes, what do you do about it? This is where an integrative approach comes into play. Instead of just throwing more medications at the problem, we address the root causes. Step 1, test, don't guess. We run comprehensive labs, hormone panels, inflammatory markers, nutrient levels, thyroid function. Most doctors run basic labs only, but basic labs miss the subtle imbalances that can sabotage your mental health. Lisa's comprehensive test showed low levels of thyroid hormones, estrogen, progesterone, vitamin D, and B12. Step 2, support your brain's foundation. Your brain needs fuel to make neurotransmitters work properly. During perimenopause, that fuel system functions suboptimally. We started Lisa on medical-grade omega-3s, methylated B vitamins, and vitamin D with K2. Within a few weeks, her sleep improved, her brain fog lifted, her mood improved. But we didn't stop there. We addressed her gut health because 90% of serotonin is produced in the gut, not the brain. We added a high-quality probiotic and showed her how to improve her nutrition. We removed inflammatory substances such as sugars and ultra-processed foods. Within 6 weeks, Lisa said, I feel more like myself than I have in years. But here's what surprised me most about Lisa's case. Step 3. Balance hormones first. Sometimes anxiety isn't a serotonin problem, it's a hormone problem masquerading as a mental health issue. Lisa started bioidentical hormone therapy. This significantly improved her anxiety symptoms. We were able to reduce her Lexapro dose by half. She lost 15 pounds without dieting. Her energy returned, her marriage improved. Here's why this works. Estrogen and progesterone directly affect GABA receptors in your brain. GABA is one of your brain's natural anxiety medications. When these hormones are balanced, your brain can naturally regulate anxiety better. But here is a mistake many women make. They think they have to choose between medication and natural approaches. That's not true. The most effective treatment combines both. I call it the both and approach instead of the either or approach. You can take anxiety medication and address the root causes. You can support your hormones and optimize your neurotransmitters. Here's the one question that changes everything. Before you take another dose of anxiety medication, ask your doctor this. Have you tested my hormones, nutrient levels, and basic labs? Hormone panel, vitamin D, B12, magnesium, thyroid function. If the answer is no, you might be merely treating symptoms, not addressing the causes. Here's what I want you to understand. Anxiety medications can be life-saving. I prescribe them regularly, but during perimenopause, they work best as part of a comprehensive approach. If you want to learn the specific nutrients that support anxiety recovery during perimenopause, watch the next video where I break down the 5 supplements every woman needs to know about.